Less than 50% of Canadians know about thrombosis. Really alarming stat, actually, that. And just in time for World Thrombosis Month, our next guests are going to educate people about the risk factors and warning signs of blood clots. Sandra Buckberrough is from Whitby, Ontario, and Dr. Alan Bell is the Vice President of Thrombosis Canada, a family physician who also teaches at the University of Toronto. So welcome, both of you, to What She Said.
Thank you.
Knowing the warning signs of a blood clot can lead to better health outcomes. Dr. Bell, tell us, what exactly is thrombosis?
Yeah, thrombosis. It's a sort of a mysterious word.
But it almost sounds like a musical instrument if you didn't know better, right?
It's definitely not a musical instrument. So thrombosis refers to blood clotting inside of blood vessels. And that can occur either in arteries, and when it occurs in arteries, it cuts off the blood supply to critical organs like the brain, causing a stroke, or the heart, causing a heart attack. But what we're going to be talking about today, I think, is when blood clots in veins, and those are the blood vessels that bring blood back to the heart. Now, when we get clots occurring in veins, that causes a whole different set of problems.
So, explain then, what is a deep vein thrombosis and a pulmonary embolism, and how that what the impact of those are?
Sure. So when we talk about those two diseases, deep vein thrombosis and pulmonary embolism, we put them together in a package that's called VTE, venous thromboembolism, and that's the disease that we're very much focused on Thrombosis Canada. So a deep vein thrombosis, or a DVT, is when blood clots in the main veins, in the deep veins, typically in the leg, but can also occur in the arms and other areas, where it stops blood from flowing back out from the legs and back to the heart, where it can be pumped to the blood, where it can be pumped to the body. So when that occurs, beyond the clot, blood tends to accumulate, resulting in pain and swelling and redness and all of the signs down in the lower legs that are very important to recognize as signs of DVT. Now, you also ask about pulmonary embolism, and that's a result of a clot in a vein. So the vein blood returns up into the heart and then it's pumped into the lung. So if one of these clots from the leg, like from a deep vein thrombosis, breaks loose, it then gets pumped into the lung and prevents blood from flowing adequately into the lung, and that is a pulmonary embolism. So pulmonary embolism, they are both very serious conditions, but pulmonary embolism is a much more serious condition. It can certainly cause sudden death or severe illness. So we do everything that we can to prevent it. And we try as best we can to recognize the presence of a DVT so we can prevent that clot from breaking loose and going to the lungs and causing a pulmonary embolism by treating it early.
Okay, so we'll get back to that. But first, Sandra, you say that if you had ignored the warning signs and hadn't acted quickly, you're certain that you wouldn't be here today. So tell us about your experience.
So, as Dr. Bell referred to, mine first presented in the arm, and I was a very healthy woman, no issues, awakened one morning to find this spot on my arm, which was red and swollen, a little bothersome, but I figured it was probably some sort of bug bite or a reaction of some sort. And I let it go. After a couple of days, I thought, this is definitely worsening. I should probably see my family physician about it. He was a little concerned that it could potentially be a clot, but I also thought it was perhaps a bug bite of some sort. We did some further testing, and it was confirmed that it was, in fact, a superficial clot. What
is a superficial clot? So that means not a serious vein?
Well, our venous system has veins that are on the surface that drain into the deep veins that bring the blood back into the rest of the body. So superficial clots are unlikely to embolize, but they certainly can extend into the deep venous system.
And it was interesting because my family doctor was very concerned and was good at educating me around, not that this is good to have regardless, but we don't want this getting to a situation that it could become deep vein. I literally was untreated and it resolved and everything was fine until about 6 months later when I awakened and the same thing presented, this time in my lower calf. Then I was prepared. I thought, okay, this is the same thing that happened. How, it's possible, I guess, that I could have another one, but I felt I should seek immediate medical attention, which I did. Few visits, it didn't happen right away, but some further testing revealed that I had a very large clot, but yet again superficial. I think the important thing for me then was making sure I kept an eye on it and being more aware this time. Literally within hours of seeking further medical attention on this leg issue, I sent a picture of it to my doctor because I could notice, excuse me, I could notice it actually traveling just during the day, that day. So sent the picture to him. He immediately got me on blood thinners, and I was referred to a specialist through Sunnybrook Hospital to seek further diagnosis and attention. And within days, it came out that it was a deep vein, and I was called in immediately by the specialist to start treatment with abdominal injections of blood thinners.
Is that the treatment, blood thinners?
Definitely. So these days, sometimes we will start with injections of blood thinners, but these days, much more commonly, we've got oral medications that we can use that act immediately and can prevent further extension of these clots and, importantly, prevent pulmonary embolism.
Well, I'm a little scared because when you say that the first time it presented, it could have been a bug bite. I mean, how many people out there would just not even think twice about it? So between the two of you, tell us what somebody should be looking for.
Well, the common signs that we have to be concerned about, I can talk about this. So at Thrombosis Canada, we're a physician organization who are dedicated to reducing the impact of thrombotic diseases.
Right.
So to raise awareness, we have come up with the acronym CLOTS, CLOTS, and that stands for the C, the first three, CLO, refer to pulmonary embolism, which can actually be the first presentation of thrombosis. You don't have to see that DVT before the embolism occurs. So C stands for chest pain. It's a slightly different kind of chest pain that we see with a heart attack, but certainly pulmonary embolism is very commonly associated with chest pain.
So what kind of chest pain?
Well, typically it's a sharp chest pain, worse with respiration.
Okay.
Worse when you breathe. But again, there are no rules. Okay,
Yeah.
It can present with different forms, different people.
So if you have a chest pain, just go to your doctor immediately.
Well, I think chest pain is a good reason to go to a doctor. It could also be heart attack. Okay. The L stands for lightheadedness. Now, if a clot is big enough that's going to the lung, it can interfere with your overall circulation, including the amount of blood that's flowing to your brain, and it can make you feel lightheaded. The O stands for out of breath. So shortness of breath, chest pain, lightheadedness, shortness of breath. These are typical signs of pulmonary embolism. The last two, the T stands for tenderness of the leg, and S stands for swelling of the leg. So, your case was a bit unusual, Sandra. Typically, when patients come in with a DVT, with a deep vein thrombosis, they will show up with a red, swollen leg. And I think that's probably the most important thing for patients to watch for, particularly if they are at risk of developing a DVT.
Do you treat the superficial veins and the deep veins and the pulmonary? You treat it all the same?
No. The superficial veins are treated a little bit differently from DVT and pulmonary and pulmonary embolism. The superficial veins, if they're small and it's not a big deal, we can just wait and watch and see them resolve spontaneously, ice packs, that sort of thing. But there are very specific criteria. If they are a certain length, if they are near where we know that they can get involved with the deep veins, then we do treat them in a similar manner to the way we treat the deep veins. The deep vein thrombosis and the pulmonary embolism, we treat pretty much in exactly the same way, assuming the patient is stable, and that's with the use of blood thinners. So these blood thinners effectively will treat the condition and will prevent embolization.
A lot of people think this is from, your risk increases because you may be inactive or you fly a lot.
Sure, that's a common perception, and it is true. If you sit around a lot or if you're on airplanes for a long time, there is an increased risk of DVT and PE. However, the important risk factors that people really should know and are not aware of, number one, hospitalization. So hospitalized patients are at much higher risk of developing clots. Two, surgery. So postoperatively, it's important that patients take action to prevent the formation of clots. And thirdly, cancer. Cancer increases your risk of blood clots a great deal. And in fact, blood clots are the second commonest cause of death in cancer patients. Number one being metastatic disease, and number two being thrombosis. So we have specific ways of preventing these from occurring in patients, but it's important that patients who have been hospitalized, patients who have cancer, and patients who have had surgery know that they are at risk and how to prevent. But other things also increase risk, like pregnancy. So women also have those increased risks associated.
So for our listeners who'd like to know more about this, where can they go to find out more?
Okay, well, Thrombosis Canada offers an excellent resource at our website, thrombosiscanada.ca. So I would encourage anybody who's interested in thrombosis to take a look over there. We have a section for professionals, but importantly, we also have a section for the public. To increase awareness, read about our CLOTS program, read about our videos, get some expert lectures that are done at lay level for people to understand and prevent suffering from complications of thrombosis.
Well, thank you both, Sandra Buckberrough and Dr. Alan Bell, for joining us today. And hopefully there will be at least one life saved because of this.
Okay, I hope so.
Thank you.
I just want to remind everybody that October the 13th is World Thrombosis Day, and watch for the CN Tower to be lit up in blue and red, as well as Niagara Falls.